welcome to this talk, and I'm delighted to welcome David Brown all the way from North Carolina. David, thank you for joining us.
Thank you, John.
Now,
nice to be here.
This video is about the Banga Project in Africa, so if you're not interested in that, turn off now, but if you're interested in that, stick around. Now, we'll see why David's on in a moment, but David, first of all, what got you interested in the Banga Project in Africa, which is a community self-help project in Uganda in Africa?
Well, actually, it was your videos that you had posted on your YouTube channel. So I started watching your videos, like most people, about a year or so ago, and I think at one point you had posted something from Mufafa, and that kind of piqued my interest. And I began looking into it a little bit. And over the last year or so, I'd been kind of thinking about ways that I could make donations. I thought about just donating all of my tips from shows. So I'm a full-time musician. I perform 3 or 4 shows a week. And so I thought maybe I'll just collect all my tips for a month and donate that. But then I've been trying to get into doing more live ticketed performances. So I decided to actually do a charity drive and sell tickets to a live event. And
great, and of course we're giving that a plug now because you're sending all these donations to the work in Africa. So thank you for doing that. This is our first ever. I'm not quite sure what the term is. Benefit concert, I suppose. It's the first time we've ever done this, so it's a completely new departure. So it's quite interesting.
It's new to me as well. So I and also this will be my first attempt at live streaming something like this to YouTube. So I'm not quite sure how it's going to turn out.
I'm sure it'll be the first of many, David. So the Banga Project, it started probably about 3 years ago, as you probably know. Mufafa and me started talking, and he was a newly qualified medical officer at the time. And we started following through particular patients who needed particular medical intervention. So some of the early ones were people diagnosed with blood diseases or diabetes or high blood pressure, things that were relatively common medical conditions in the area that were most of them relatively straightforward to treat, but because of the poverty and the difficulty accessing medical conditions, there was difficulties there. So we started sponsoring a few patients there. We sent some money from the channel, some money was raised by viewers, and that gradually built up. And we realized that, of course, it's not just the medical problems. We wanted to prevent disease as well. So we started looking at things like planting trees, agricultural development, looking after poor children, supplementary feeding, doing things that would sort of promote health in general. And this is kind of the philosophy, really, putting in relatively small amounts of money, always working through local people, employing local people wherever possible, and empowering the community to try and improve its own health. And then another friend from the UK, Sean Roberti, he's organised some money for a mill. So we've now got a mill to produce flour. So we're actually grinding quite a lot of flour now. And the good thing about that is we can buy in the maize, we can grow the maize on some of our own land as well. And then we can mill that and we can sell it at a profit. And of course, we can plough the profits back in. And the profits from the mill are currently feeding 200 very poor children who otherwise would be struggling for food at the moment. So it's this kind of self-help, but sustainable work that we're doing.
I think that's kind of what got me interested in it overall. Is it's one of those cliches that people use as kind of a way of disparaging government-funded charity. But if you give a man a fish, he eats for a day, teach him to fish, blah blah blah. I actually look at it a different way, more like what you're doing. You're empowering this community to sustain themselves. And it really, I saw integrity in you and the way you talked on your videos and how you follow the data, not just blindly leaping off cliffs and etc. And I figured by extension that would probably, if you were working with Wufafa, then he probably was operating with those same underlying principles. And I've spoken to him a few times. He's a really nice guy, and the videos were really touching. Just watching the children, knowing that even small amounts of money can really do a lot of good in the right hands in a place like Uganda. So, yeah.
I mean, as you probably know, there is problems with corruption and money not getting where it's supposed to get to. So, I like you. I talked to Wufafa a lot of times on the phone. We did Skypes. We did some video interviews together, and everything seemed to be checking out. He kept saying things, and I thought, well, I agree with that. So the idea of preventing disease rather than curing it wherever possible, the idea of promoting nutrition, ecological benefit, sustaining, improving the land, all that kind of thing. Animal welfare is also quite a big part of it.
Right.
Got common interests in that. So it seemed like it was all checking out. And then I was actually visiting some friends in Kenya last year. So we were able to get a week in Uganda, and we flew there. Wufafa picked us up from Entebbe at the airport, and then we went there. And but basically, all of my hopes for the way things were working were confirmed during that time. It all checked out. The money was all going where it was supposed to be. Other people have gone from the UK since then. I'm hoping to get back. Not quite sure when. Hopefully in the next few months again for a longer period of time.
Be nice.
I can't practice in Uganda. I'm not licensed to practice there. But we can talk about problems and we can talk about things.
You can always help. Volunteer, even if you're just picking crops or something. I don't know.
Yeah. There's always, you can always there's always something to do and talk people to talk to.
Yes, sir.
And the other thing that I like about this project is everything is done completely legally. So we go through all the Ugandan authorities. We're going by the local what you might call folk tradition. So we're consulting with the local elders. We're doing things properly on the local level. We've also got legal trusts established at the regional level and the national level. So we are now an official Ugandan government recognised non-governmental organisation. All the accounts are filed. It's all completely squeaky clean. And what the other thing we're hoping is that the approach we're using is going to be kind of a model for other people to follow. So we can say, look, this is what we can do in this particular community with fairly basic resources. We're only talking a few thousands of dollars, a few tens of thousands of dollars altogether have gone into this project. We're not talking huge amounts of money, and yet this has completely transformed the health of quite a large number of people. Well, I hope that video gave some insight into what's going on with the Banga Way to Health project, a kind of a model project that we're working on in Uganda. Now, David did do a live song at the end of that interview, but unfortunately it's flagged up YouTube's automatic copyright recognition system, so we couldn't leave it on. David did give permission, of course, but it's gone through the automatic system, so we can't put it on. So check out the live gig. It's on today at 4:30. It is Saturday the 16th of December. It's on at 4:30 Eastern time, but you'll be able to watch it at any time after that, and there'll be a link to make donations to the project if you'd like to support what David's endeavour in this. Great project. Pity about the live song. It was really good, but it flagged up the algorithm. So top of the description there's links to the music, to David's site, to Wufafa's site, and we'll also put a link for donations that go directly to the work in Africa if you're interested in that. And there's also ways to communicate directly with Wufafa if you'd like to do so. Lots and lots of videos on Wufafa's channel. Check them out. Fascinating to follow the individual stories through. But for now, thank you for watching, and check out the gig.